I'll be your nurse this afternoon if you need anything. Okay.
He was admitted into ED last night with some chest pain while he was at work. We did an ECG on him which confirmed his suspected MI. He's got some, like an angioplasty scheduled on for later today.
Yeah.
Obs are all fine, he's just got some IV fluids running. And we've tried some Cobrasil, 4 milligrams for him today. And he just got a little bit of chest pain at the moment, that's all. Is that correct?
It comes and goes.
Yeah.
Okay. No worries. Thank you.
All the best, Lachlan.
Thank you. Alright, so this is your call bell, so if you need me, just press that. I'm just going to do the rest of handover and then I'll be back. Do you need anything at the moment?
I'm good, thank you.
Okay, I'll be back then. I've just got some medication for your heart. I just need you to tell me your name and your date of birth.
Lachlan Matthews, 4th of December, 1970.
Brilliant. And do you have any allergies?
No.
Okay, great. So yeah, so like I said, this is some medication for your heart. We'll just stabilise it a little bit just while we're waiting. Alright, here you go. And here's some water.
Thank you.
Thank you very much. Alright, so let me know if you feel any different, any dizziness or anything like that. Yeah, and I'll come back in straight away, so press that button if you need me, okay? No hesitation as well. Yeah, all good. Thank you.
Thank you. Nurse.
You right there? What's happening?
I feel really dizzy. I feel like I'm gonna throw up.
Okay, and when did this start?
A couple minutes ago.
Okay, great. I'm just gonna get the blood pressure machine and I'm gonna get your vomit bag as well, okay? I'll be back.
Okay.
Alright, so here we go. There's that. Alright, so I'm just gonna check your blood pressure, okay? So you're feeling really dizzy?
I feel fine, dizzy.
Everything?
Fucking gonna throw up.
Alright, let's put your feet up a little bit. Thank you. Okay, can I bring this arm for a minute? Thank you. Alright.
Is everything okay?
Yeah, it's all good. I'm just gonna get the doctor to check something, okay? Alright. Is everything alright? Yeah, so we have Lachlan here. He is just kind of like felt really nauseous and dizzy. He's got a blood pressure of 77 over 55. Significantly low. We've given him what
So
was
we've
it?
given him the Cobrasil?
Yeah, the Cobrasil.
4 milligrams of Cobrasil?
No, I gave him 8 milligrams.
Okay.
Okay.
I'm just giving you a medication just to make you feel a little bit better, alright? Good.
What's going on? Oh, what's going on?
Lachlan, how did that make you feel?
Made me feel scared, confused. I felt really neglected as a person. Nobody told me what was going on. I thought I was having another heart attack. I was really, really scared for my life.
What could you have done better?
Well, first of all, I could have explained to the patient and been honest of what happened, and from that I could have got consent of what treatment options, and basically just being open about and include the patient.
How do you think they could have handled it better?
I feel like they could have been more open about the medication error. I feel that they could have introduced me, to the doctor. I had no idea who was coming and going. I felt so scared, and if somebody had have reassured me that I wasn't having another heart attack, that would have been really good. And also just the consent. I had this needle come out of nowhere, and it would have been nice just to know that, having that little bit of control over what goes into my body.
What are the consequences of your actions?
Well, I broke the rapport between my patient and the trust between my colleagues as well and the doctor, and may have lost my registration from it.
Debriefing is a very significant part of nursing, and it is also a very significant part of the conclusion of a scenario. This debriefing process allows for all the individuals involved to have the opportunity to openly process and discuss what has happened, how they reacted, and how they perceive the situation. The feedback received and the reflection that is conducted during this debriefing process is essential in developing nursing skills. This is a very basic but reflective tool that can be used in any situation as a teaching strategy to develop clinical skills and affirm feelings and emotions that one might be experiencing. The debriefing model that we chose was ORID. ORID is a reflective debriefing model that is very commonly used following nursing simulation. ORID stands for Objective, Reflective, Interpretive, and Decision. Using all these 4 stages to gather data from them allows for successful and thorough debriefing to occur. This reflective debriefing process, through the evaluation and interpretation of the shared experience, allows for individuals involved in the debriefing to gain a greater understanding of the situation. We chose this debriefing model as it enabled us to evaluate our experience both together and individually, and to assist us in describing and reflecting upon the situation we were in. This model also helped us take into consideration each person's role in this scenario and how that individual was impacted by it. The first 2 scenes in our video are all about Lachlan, which allows us to get some background about him and what has happened to him. Following the handover from the ED nurse, the registered nurse, Nikki, administers the incorrect medication dose to her patient, Lachlan, who has just been transferred on her ward from ED. Shortly after this incident, Lachlan begins to feel very unwell, and he calls for Nikki to come to his bedside. She then takes his blood pressure and presses the emergency buzzer right away. Despite the fact that Lachlan is asking her what is going on, Nikki focuses on the doctor and the conversation that they are having regarding the medication. The doctor administers an IV medication and tells Lachlan that he will be fine. Throughout this whole scenario, neither Nikki nor the doctor involved the patient and asked for consent or answered his questions. Instead, they left Lachlan feeling very confused and scared, as he had no idea what was going on. Here in this video, we can see both perspectives. One is Nikki, who got very, very scared about the fact that she had given the wrong dose of medication and immediately reacted and called for the doctor right away. And we also see Lachlan, who, on the other hand, is confused and has absolutely no idea what is going on and isn't being told anything. Looking back at this scenario, it made us realize that this situation is actually a very relevant one to nursing students, and that it's really important to reflect on it, as it shows the importance of communicating with your patient. This is a situation that unfortunately many nurses have been in, and that we as newly graduated nurses next year could possibly be in as well. We felt as though this experience of Lachlan feeling very confused, and his reaction was definitely a reflection of what was going on in his head and a reflection of his thoughts as well. He was left in the dark about what was going on in the situation. He wasn't told anything. His questions weren't answered, and he just felt like he was so out of his depth as well. Lachlan probably hasn't been used to being in a hospital, and this isn't his usual environment. So being in that situation, feeling really, really bad and unwell, and not having health professionals answer your question definitely left him feeling very scared, and we can definitely see that afterwards when we ask how it made him feel. Although Nikki made a mistake, however, she was really, really quick to respond, and she made sure that Lachlan got the right treatment right away, and that it reversed the mistake that she made. Hearing how it made both Nikki and Lachlan feel, it definitely helped us see both perspectives. And although Nikki was doing the right thing and she called the doctor right away and she was very quick to respond, she definitely understood how that made Lachlan feel, and she felt bad that he was really confused and he was really scared and he had no idea what was going on. And she did admit that asking for consent would have made the world of a difference, and answering one simple question would have also made a really big difference in the care that he received. So, as mentioned previously, this experience is one that can happen to any nurse at any stage of their career, and it's a situation that has taught us the importance of communication and also what the lack of communication can result in. This video is very relevant as it shows us the perspective of the patient, which is something that we actually rarely get to see as nurses. We're on the floor and we get to see our perspective, and it's busy and it's fast paced, but we don't ever get to see how the patient truly feels in that moment, when we can sometimes neglect them and forget to communicate with them. So we believe that this scenario is one that is very relevant to nursing, as it happens quite and it's something that we could be stuck in ourselves one day as well. The situation could have obviously been handled much better by the nurse and the doctor, and Nikki could have kept the patient informed of what was going on, and she should have answered his questions, and when he asked her what was going on, she should have informed him of the treatment and the medication that he was getting and what had happened and what she had done. And while waiting for the doctor, Nikki could have apologized, and she could have told him what had happened when she accidentally gave him double the dose of his medication. Both the doctor and Nikki should have asked Lachlan for his consent before giving him the IV medication, despite the fact that he was feeling unwell and that they had to do it right away. As a result of this experience, we've gained skills that are definitely can be put into practice if the situation ever arises in a clinical setting and when we are working as nurses. This scenario is definitely one that is very, very relevant, as mentioned before in this video, in this debrief. We get busy as nurses. Nursing is a very hard job and it is very high paced, and little things like communicating and answering questions can quickly be forgotten by us. It's a very basic thing that we learn as nurses, but it's also one that can be forgotten, and it's one that sometimes we can, neglect our patients and we can forget to answer their questions. And through reflecting and debriefing about the situation, it actually shows us how important communication is, how simple it is, but how effective it can be when you're caring for someone who has absolutely no idea what is going on, and who has no medical background and who's never been in a hospital as well. And I think as a result of this experience, we've definitely gained skills that we can put into practice, and skills that absolutely every single nurse needs when they are